Gentlemen, your me time might feel relaxing, but if you're over 60, the way you do it could be silently working against your prostate health. In this video, you'll discover the most common private health mistakes men over 60 make, and how small changes in your routine can protect your prostate, boost circulation, and support long-term vitality. These are science-backed tips every man should know before it's too late. Now, I know this isn't the most comfortable topic to discuss, but stick with me here. By the time we're done, you'll know exactly what these mistakes are, and more importantly, how to avoid them while actually improving your prostate health. Because here's what most men don't understand. When done right, regular sexual activity can actually protect your prostate, not harm it. Let's start with something most guys don't fully grasp. Your prostate isn't the same organ it was when you were 30. It's been quietly growing this whole time, and that's completely normal. By 60, about half of all men have an enlarged prostate. By 70, it's closer to 70%. Think of your prostate like a donut sitting around your urethra. As it grows larger, it can start squeezing that tube, making it harder for urine to flow freely. This natural enlargement process is called benign prostatic hyperplasia, or BPH, and it affects nearly every man if he lives long enough. But here's what's crucial to understand. This growth isn't just happening randomly. Your hormones are changing too. Testosterone levels decline, while estrogen levels can actually increase. These hormonal shifts affect not just the size of your prostate, but also its sensitivity and how it responds to stimulation. Now, certain activities can either help manage this natural change or make things significantly worse. That's where the mistakes come in, and unfortunately, most men are making at least one of them without even realizing it. Mistake number 1. The pressure problem. Here's the biggest mistake I see men making: using too much force or aggressive techniques. Listen, your prostate at 60 isn't built like it was at 25. The tissues are more delicate, the blood vessels more fragile. Yet many guys approach self-pleasure the same way they always have, sometimes even more aggressively because they think they need more stimulation to achieve the same results. This is dangerous thinking. Aggressive pressure can cause bleeding around the prostate, infections, and tissue damage. If you already have some inflammation from normal aging, which most men do, adding rough handling is like poking at a bruise repeatedly. What many men don't realize is that the prostate becomes more sensitive to pressure as we age, not less. The membrane surrounding it gets thinner, and the internal structure becomes more fragile. What felt comfortable at 40 might cause real damage at 65. I've seen men who think that because they're not feeling as much sensation, they need to apply more pressure or use more aggressive techniques. This creates a dangerous cycle where you're actually damaging the very organ you're trying to stimulate. The fix is simple, but requires a mindset shift. Be gentle. If you're exploring any kind of prostate stimulation, think massage, not pressure. Your body will actually respond better to gentle, sustained touch anyway. Think about how a professional massage therapist works. They use consistent, gentle pressure that Mistake number 2. The all-or-nothing trap. Here's something that might surprise you. One of the biggest mistakes isn't doing too much, it's doing too little. Many men over 60 dramatically cut back on sexual activity, thinking it's just part of aging or feeling embarrassed about changes in their body. Some stop altogether, convinced that their sexual days are behind them. This is actually counterproductive for prostate health. Research involving nearly 30,000 men found something remarkable. Regular ejaculation can reduce prostate cancer risk by up to 31%. Men who ejaculated 4 to 7 times per week were 36% less likely to develop prostate cancer before age 70. Why does this work? Your prostate constantly produces fluid, about 1 milliliter per day. When that fluid isn't regularly expelled, it can allowing harmful substances like inflammatory compounds and potential carcinogens to build up. Regular ejaculation acts like a natural flushing system, clearing out these substances and keeping your prostate healthier. Think of it like a water pipe in your house. If water sits stagnant for too long, it can develop problems. But if you keep the water flowing regularly, everything stays clean and functional. But here's the other side of this trap. Some men think, if some is good, more must be better. Compulsive behavior that interferes with daily life or causes physical discomfort isn't the answer either. The sweet spot seems to be regular, consistent activity, not compulsive but routine. Think of it as maintenance for your prostate health, like taking vitamins or going for walks. Mistake number 3, using the wrong products. Now let's talk about something many men are too embarrassed to discuss with their doctors: what they're using for lubrication. I've seen guys reach for hand lotion, petroleum jelly, even cooking oil. Some use soap thinking it'll provide lubrication while cleaning. Please don't do any of this. Your urethra and the tissues around your prostate aren't designed to handle these substances. Petroleum-based products like Vaseline can trap bacteria, creating the perfect environment for infections that can travel up to your prostate. Lotions with fragrances and preservatives can cause irritation, allergic reactions, and disruption of your natural pH balance. Soap is particularly problematic because it's designed to remove oils and can severely dry out sensitive tissues, leading to micro tears that invite infection. And household oils? They can go rancid, develop bacteria, and cause serious complications. The solution is straightforward but requires getting over the embarrassment factor. Use water-based or silicone-based personal lubricants designed for intimate use. These products are pH balanced, won't harbor bacteria, and are specifically formulated to be safe for contact with mucous membranes. Yes, it means an actual purchase at a pharmacy or online, but your prostate health is worth that momentary awkwardness at checkout. Many stores now have self-checkout options if that makes you more comfortable. Also, and this is crucial, avoid household objects that weren't designed for intimate use. Emergency rooms see thousands of men each year with injuries from inappropriate items, everything from vegetables to tools to random household objects. These can cause tears, infections, or get lost inside the body, requiring emergency surgery. Stick to products specifically designed for the job with flared bases and body-safe materials. Mistake number 4, ignoring your body's signals. This might be the most dangerous mistake of all. Ignoring warning signs or dismissing them as normal aging. Pain during ejaculation is never normal, regardless of your age. Blood in your semen or urine isn't something to wait and see about. Changes in ejaculation volume, force, or consistency aren't just inconveniences to shrug off. Your body is remarkably good at telling you when something's wrong, but many men have been conditioned to tough it out or assume that discomfort is just part of getting older. This mindset can be dangerous when it comes to prostate health. For example, if you notice your ejaculation has become painful, it could indicate prostatitis, an infection, or other conditions that respond well to early treatment, but can become serious if ignored. Blood in semen might be a burst blood vessel, which is relatively minor, but it could also be a sign of infection, enlarged prostate, or even cancer. Changes in ejaculation patterns can tell you a lot about your prostate health. If your ejaculation volume has decreased dramatically, if the force has changed significantly, or if the consistency has altered, these are all signals worth investigating. Too many men assume these changes are just part of aging when they could actually indicate treatable conditions. The key is distinguishing between normal age-related changes and signs that require medical attention. If you're experiencing any concerning symptoms, have a conversation with your doctor. Don't suffer in silence out of embarrassment. Remember, your doctor has seen and heard it all before, and they need accurate information to help you maintain your health. Here's something even well-informed men miss. Timing matters more than you might think. If you have an active prostate infection, any kind of stimulation can actually spread that infection throughout your body, potentially leading to serious complications like sepsis. If you're on medications like alpha blockers for an enlarged prostate, they can affect how ejaculation works. These medications can cause retrograde ejaculation, where semen goes backward into your bladder instead of out through your penis. While this isn't dangerous, it can be alarming if you don't expect it. Similarly, if you've had recent prostate procedures like biopsies, your doctor will give you specific guidelines about. Ignoring these guidelines can lead to complications, bleeding, or infection. The key is having open conversations with your healthcare provider about how to maintain sexual health while managing any medical conditions. Your sexual health is part of your overall health, and your doctor should treat it that way. If they seem uncomfortable discussing these topics, it might be time to find a healthcare provider who takes a more comprehensive approach to men's health. As we age, our immune systems become less robust, making proper hygiene even more important for preventing infections that can affect prostate health. Always wash your hands thoroughly before any intimate activity. And I mean a full 20 seconds with soap and warm water, making sure to clean under your nails and between your fingers. If you're engaging in any kind of anal contact or prostate stimulation, this becomes even more critical. The bacteria that naturally exist in that area can cause serious urinary tract infections if they make their way to your urethra or prostate. After sexual activity, always urinate. This simple step helps flush out any bacteria that might have entered your urethra during arousal or orgasm. It's a 1-minute habit that can prevent weeks of discomfort and potentially serious infections. When cleaning your intimate areas, use mild, unscented soap and be gentle. Harsh products or vigorous scrubbing can disrupt your body's natural bacterial balance and actually increase infection risk. The skin in your genital area becomes more delicate with age, so treat it accordingly. So what's the right approach for maintaining prostate health through your 60s and beyond? First, maintain regular sexual activity. Aim for ejaculation 4 to 7 times per week if possible. This isn't a performance requirement or something to stress about. It's a health recommendation like getting enough sleep or eating vegetables. When you do masturbate, be gentle and patient with yourself. Use appropriate lubricant every time. Take your time and pay attention to your comfort level throughout. If something hurts, stop immediately. Your body is telling you something important. Consider investing in quality products designed for intimate use. This might mean purchasing proper personal lubricants or, if you're interested in prostate stimulation, toys specifically designed for that purpose with body-safe materials and proper shapes. Think about your positioning, too. Many men find that lying on their back with proper support reduces strain on the pelvic floor muscles. If you have back problems, try lying on your side. The key is finding what works for your body without causing strain or discomfort. Consider your overall lifestyle, too.